everyone. This is Pooja Patil, and I'm delighted to welcome you all to day two of our three-day webinar series, Spill the Beans for the Healthier Tomorrow, presented to you by SIMSA on the occasion of World Food Day this month. South Indian Medical Students Association, or SIMSA, it was founded by a group of passionate students, medical students, for greater representation of students of South India on international platforms and providing opportunities and exposure for South Indian medicals. SIMSA is recognized under the Government of India and one of the fastest growing medical students association. Before I begin, I'd like to lay a few ground rules. If anyone has any doubts during the session, please don't hesitate to ask. You can use the YouTube comment section to post your queries, which will be answered at the end of the session. At the end of the session, we will be posting a post-webinar and feedback form on the YouTube comment section. Please do fill that form to receive certificates, and feedback is for our evaluation. We as society, even as medical students and healthcare professionals, we often fail to realize how nutrition and our diet can affect the various physiological aspects of our body. We have been shifting from an era of communicable diseases to an age of non-communicable ones, obviously before the pandemic, of course. Cases of hypertension, diabetes, hypothyroidism, PCOD, obesity have never been higher, almost women suffering from one or more of such diseases. All right, let's begin. With this, I'd like to welcome our guest speaker for the day, Mr. Roman Sherwani, who gave us some wonderful insights yesterday regarding lifestyle and nutrition. And he is kind enough to join us today for this webinar as well. For those who don't know, Mr. Roman Sherwani has 13 years of work experience in his field. He has qualifications in personal training from CPT from American College of Sports and Medicine and holistic lifestyle coaching from Czech Institute. He is a practicing nutritionist and a health coach. We welcome you, sir, and thank you for taking the time out of your day and joining our webinar. We are extremely grateful to have you here with us today.
Thank you, Pooja. Thank you.
In today's webinar, we will be discussing some of these extremely important and major diseases and disorders. Our speaker will be giving a brief outline about the disorders and followed by nutritional and lifestyle changes that can help fight these diseases, which our guest speaker today will be talking about. Our speakers for today are Gauri Krishna, Lakshita Jain, Leah Paul, and Sushit C. And now I hand it over to our first host of the day, Ms. Gauri Krishna.
Good evening, everybody. Our first topic for today is obesity and heart disease. So, India is currently in the clutches of a disease that has reached epidemic proportions. More than 23% of our population are obese. What was once just a cosmetic concern has taken the position as a forerunner to a leading cause of death worldwide. But here is the most concerning part. How did a condition that was so preventable still outsmart the human race? To understand this, we should first know the definition of obesity. Obesity, as such, is defined as a disorder involving excessive body fat that increases the risk of health problems. It is expressed in terms of BMI, which stands for body mass index, and it is calculated by the weight of the person in kilograms by the height in meter square. Now, the normal BMI is from 18.5 to 24.9 kg per meter square. A person is considered to be overweight if the BMI is more than 25, and obese if the BMI is more than 30. Now let's discuss the causes of obesity. The causes can be genetic, behavioral, metabolic, and hormonal. But the most important cause of obesity is the imbalance between the calorie intake and the calorie expenditure. The burgers, the pizzas, the Coke, every single fast food to those carbonated drinks, all of it are really high in calories. Adding to the burden, obese individuals require more food to feel full. They become hungry very quickly and eat more during stress and anxiety. Apart from the cosmetic problem, it creates a lot of deep seated problems too that can affect all the systems of your body, especially your cardiovascular system. So what happens is, as soon as in an obese individual, what happens is there will be accumulation of cholesterol in the blood vessel. So there are two types of cholesterol in the body, which are the LDL and the HDL. LDL is known as the bad cholesterol, and HDL is known as the good cholesterol. So what happens is, in obesity, there will be more accumulation of these LDL, which is the bad cholesterol. So this leads to increased blood pressure because of the narrower blood vessels. All right. So what will happen is, this will lead to changes in the heart, which manifests as changes in the ECG. Fatigueness can be felt, swelling of the extremities, chest pain, palpitation, that is feeling of your own heartbeats, shortness of breath are few among the changes seen. On top of this, what happens is obese people tend to have increased intolerance to insulin, which leads to diabetes mellitus too. So as you can see in this picture, there are two images. The first one shows that every 10% decrease in the body weight improves or prevents the chances of cardiovascular disease. And the second picture shows that every 10 years you stay obese, the chances of cardiovascular diseases increases by 1.25 times. Now, the choice to choose between the first healthy 10% decrease or the second unhealthy 10 years is our choice. Now, we'll quickly go through the complications of obesity. Obesity, as such, decreases not just the quantity, that is, the number of years, but also the quality of life. That as obese people tend to be discriminated in the society. This leads to depression, sexual dysfunction, disability, and cancers, especially involving your GI tract as well as gynecological carcinomas too. Adding to the list of complications, we have osteoarthritis, osteoporosis, menstrual dysfunction in females, gout, erectile dysfunction in men, PCOD. The list of complication goes on and on. Understanding the seriousness of this situation, WHO came up with a WHO action plan for the period of 2018 to 2030. The main aim of this program was to increase the active people to make a healthier world. The main objectives or the guidelines of this action plan included increase physical activity, avoid sedentary lifestyle, improve your eating habits, and lastly, follow your life cycle properly. To sum up on what we discussed so far, we clearly understand the fact that proper diet and healthy lifestyle is the key to prevent the disorder from becoming another pandemic. To enlighten us on how to maintain a proper diet and a healthy lifestyle, I invite our guest speaker, Mr. Roman, to tell us more about it. Over to you, sir. Thank you.
Hi, thank you. Yeah, this is one of the big struggles for the society today. Of course, internationally, I don't think it's just such a uh, big issue for our country, but definitely since we're talking about just this country today, a lot of food choices that culturally Indians are inspired to eat are not necessarily entirely the culprit of this problem. The major issue that I see in work is from uh, diets or the clients. When I work with them, they have these very refined carbohydrates or very processed foods that are generally considered bad for every other culture, every country on the planet. So processed food diets, or not necessarily just fast food, but a lot of time packaged foods, which are very refined sugars and carbohydrates loaded with trans fatty acids. These diets are one of the biggest components of creating a lot of excess fat deposits in the body. They also contribute to a lot of hormone irregulations and chronic inflammation. So diets rich in whole foods is the best way that people can approach this issue, and this will obviously end up making the whole body very, very healthy in other regards also. It's not just necessarily whole foods in terms of vegetarian or specifically non-vegetarian. I think the holistic system of eating, which is mainly consisting of very, very fresh produce vegetables, some fruits, some local seasonal wild berries, nuts and seeds, whole grains, uh, depending on what grains people are allergic to, what they are not allergic to. They have to decide this individually for themselves. But um largely whole grain based, vegetable based, fresh produce based diets work phenomenally well for creating this sense of satiation and bringing enough micronutrients in the body so your body's requirements, daily allowance requirements, are met by food. That's one of the big ones that I find in work. Yeah.
Sir, there's a question. So now we get to know about a lot of products and and even companies telling us about rapid weight loss, right? So what is your take on that? Is it good for our health, or will there be any problems because of that? Even there are products which can just be used. Drinking it can reduce your weight up to 7 kg. Uh, such advertisements keep on coming. So what is your take on that? Is it healthy?
Uh, so I can't personally speak about everything which is available in the market out there for reducing weight in a very rapid manner. I personally don't feel confident enough of claiming any of such results with work. But I also definitely never endorse or advise my clients to go on such uh, good term will be fat burning supplements or steroids or other performance enhancement chemicals which are available. There are some supplementation in the food industry which could be probably classified as nutraceuticals, or another term would be multivitamins and multiminerals. That could be probably beneficial for a lot of people who are consuming diets which are not very rich in micronutrition. So, supplementing with vitamins and minerals is maybe one of the ways that is considerably safer. But the claims that are specifically around rapid fat loss or lose 40 kilos in 40 days type of marketing gimmicks, these are really, really harmful. Usually, they end up creating long-term toxicity problems and hormonal imbalances in mostly every human being. So, I would advise stay away from that mostly.
So last question. So there are a lot of people out there who gain weight because of episodes of anxiety and depression. So they tend to eat more during those episodes. So what is an advice that you have for those people?
I think the general understanding of anxiety and depression is very limited for the general population, for at least the people who end up becoming uh, unhealthy during these hormonal fluctuations or neurotransmitter imbalances or genetic predispositions related to these conditions. But the very common observation that, according to my work, I have found is when you are in a state which is not emotionally very balanced or very um, considerably normal state that most human beings are functional in. So anxiety and depression are just two of these labels that we find in generally not normal state of human behavior. These people who are going through anxiety or depression or some other disorder, mood imbalance wise, they generally tend to consume a lot of sugary, refined carbohydrate based diets. And there is definitely a component of consuming sugars and refined carbohydrates and feeling a little better, because the whole ingestion of sugar releasing some serotonin and the neurotransmitters come into play. So the mood can be temporarily uplifted. But that starts a very, very dangerous hypoglycemic roller coaster again. If you consume sugar, it will crash very quickly, and then you will want to eat sugar again. So what people end up doing is creating this loop of consuming sugar, consuming sugar, consuming sugar for this momentarily feeling of happiness or slightly far away from very uncomfortable anxiety or depression. But long term approach for them will be consuming balanced portion of diet which has protein, fats, and complex carbohydrates put together. That's generally what's been shown in research is to work wonderfully for people who have mood disorders and they emotionally eat a lot of carbohydrates.
Right, right. So thank you. So one last question: what is the sort of nutrition that you would advise for a patient with cardiovascular problems?
Depends on the extent of the problem, depends on other complexities. When I'm working with such cases, I'm usually working with their doctors very closely to figure out really what is their advice on the technicalities and the risk factors. But generally, if it is very advanced cases, then very safe approach is to focus mostly on a lot of fiber rich diet, fiber necessarily coming from soluble and insoluble both aspects. So vegetables play a big role in such diets. Healthy fats, unsaturated healthy fats definitely is a safer approach for that. A form of fatty acid that I really like using in practice is fish oil, specifically for the EPA and DHA component of it. That is very anti-inflammatory in nature, so it can definitely help a lot of not just cardio complexities, but related to other chronic conditions in the body. Fish oil is one of the big components for anti-inflammatory approach towards helping my clients when I'm working with them. So generally, if you're specifically looking for a diet plan for a cardiovascular advanced condition, then I think it majorly consists of vegetables and some sort of very healthy unsaturated fatty acids combined, moderate amount of protein, of course. High proteins consumed also convert into blood sugar. So there is a component of the body which actually heavy dose of protein will also create a lot of blood sugar irregulations in the body. So hypoglycemia can be still achieved with heavy consumption of protein. So moderate amount of protein, decent amount of just fatty acids which are unsaturated, and big portions of vegetables is usually the approach, I would say.
Thank you, sir, for that information. Pooja, can you please enable my video? Yes, thank you. Now moving on to diabetes mellitus, one of the complications of obesity, to which India is one of the largest contributing countries worldwide. According to the World Health Organization, diabetes mellitus is defined as a heterogeneous metabolic disorder characterized by the common features of chronic hyperglycemia with disturbance of carbohydrate, fat, and protein metabolism. It is a leading cause of morbidity and mortality world over. It is expected to continue as a major health problem owing to its serious complications, especially end-stage renal disease, ischemic heart disease, gangrene of lower extremities, and blindness in adults. What are the symptoms? It can be appreciated that hyperglycemia and diabetic mellitus does not cause a single disease, but is associated with numerous diseases and symptoms. The classic triad of symptoms seen in diabetes mellitus are polyuria, frequent urination, polydipsia, intense thirst, and polyphagia, increased appetite. Apart from these, increased fatigue, sudden weight loss, delayed wound healing, sexual problems, blurry vision, numb or tingling extremities, and vaginal infection may also be seen. So, types of diabetes mellitus. Based on etiology, diabetes mellitus is divided into two broad types, type 1 and type 2. Type 1 constitutes about 10% of cases of diabetes mellitus. It was previously termed as juvenile onset diabetes due to its occurrence in younger age and was called insulin dependent diabetes mellitus because it was known that these patients have absolute requirement for insulin replacement as treatment. However, in the new classification, neither age nor insulin dependence are considered. Instead, based on underlying etiology, type 1 diabetes mellitus is further divided into 1A, immune-mediated, and 1B, idiopathic diabetes mellitus. Type 2 diabetes mellitus comprises about 80% cases of diabetes mellitus, previously called as maturity onset diabetes or non-insulin dependent diabetes mellitus of obese and non-obese type. Although type 2 predominantly affects older individuals, it is now known that it also occurs in obese adolescent children. Another type of diabetes, known as gestational diabetes mellitus, affects about 4% pregnant women due to the metabolic changes during pregnancy. Although they revert back to normal glycemia after delivery, they are prone to develop diabetes mellitus later in life. The causes and risk factors. Causes. Hypoglycemia may result from reduced insulin secretion, decreased glucose uptake by the body, or increased glucose production. The major risk factors include family history of diabetes mellitus, obesity, sedentary lifestyle, history of gestational diabetes mellitus, hypertension, dyslipidemia, polycystic ovarian disease, or history of vascular diseases. The clinical features and complications of diabetes. The clinical features of type 1 diabetes mellitus usually manifest at an early age, generally below the age of 35, and the onset of symptoms is often abrupt. Type 2 diabetes mellitus generally manifests in middle life and beyond, usually above the age of 40, and the onset of symptoms is slow and insidious. The complications. As a consequence of hyperglycemia, every tissue and organ of the body undergoes biochemical and structural alterations, which account for the major complications in diabetes, which may be acute metabolic or chronic systemic. The acute metabolic complications include diabetic ketoacidosis, hyperosmolar non-ketotic coma, and hypoglycemia. The late systemic complications are atherosclerosis, diabetic microangiopathy, nephropathy, neuropathy, retinopathy, and infections. I now invite our guest speaker, Mr. Roman, to guide us on the nutrition for diabetic patients. Over to you, sir.
Hi, thank you. I think diabetes is also specifically type 2 is majorly comprised of similar issues that become obesity in some patients. Some patients manage that very well, but the large issue is still with chronic inflammation and foods that contribute to underlying inflammatory pathways in the system. But generally, when I'm working with clients who have very full-blown advanced scale of diabetes, then the technical understandings could be very different from one person to the other. But general guidelines that help my clients improve their diabetes status or keep it under control is the similar guidelines for obesity. I think majorly eating complex carbohydrates, which should be just really, really healthy whole grains, the ones that are not allergic to them specifically. Some people have allergies to certain grains and seeds, so they should figure that out for themselves. If they don't, then they can work with me or investigate that in food testing, food allergy testing, or genetic testing, or some other ways of figuring out what foods are not working well for them. But vegetables are largely safe for most of these individuals. So really focusing on complex, fiber-rich, insoluble, fiber-rich vegetables is one of the big components of food when I'm working with diabetic clients. Some amount of protein, because protein management is again one of the challenges. If you consume a lot of protein, then that will again cause fluctuations in blood sugar regulation, and that is one of the big like hypoglycemia specifically is one of the big concerns for diabetic patients. So regulated blood sugar is one of the big components, and I think easily achieved with a lot of vegetables, moderate amount of protein, and then very healthy and safe fats, which largely fall into unsaturated fats. But some amount of saturated fat is obviously okay, given their liver functions are okay and their cardiovascular health is not at risk. But yeah, that's the basics of diet for a person who's struggling with diabetes.
Yes, sir. So we had some questions. There are some fruits that that people should avoid, that diabetic patients should avoid, and some that they can consume. So can you help us out here, sir?
I think for a lot of people, refined starches, refined carbohydrates, sugars are clear to steer away from. Like they should definitely stay away from really refined sugars. And a lot of clients don't understand the food which is not sweet can also turn into sugar in the body. So refined flours, refined carbohydrates in the respect of grains, or sometimes even de-shelled or completely fiber taken out of lentils and legumes can also fall into that category. They can spike up the blood glucose very quickly, and then that comes crashing down very quickly again. So the whole up and down of blood sugar regulation is one of the big components of eating refined carbohydrates, which turns into blood sugar in the body. It may not taste sweet, but it will still have that effect in the system as eating white sugar. So really, it takes a while for clients to understand what is dangerous. It's not really just one handout, one printout of advice. Usually, they have to spend more time with practitioners to really understand the complexities of each ingredient. Largely, what I try to advise my diabetic clients is based around eating a lot of vegetables, all sorts of vegetables, greens, yellows, reds. Seasonal and local is definitely one of the big highlights of vegetables. One portion of foods that I really, one type of foods that I typically enforce, almost force them to eat is bitter foods. So bitter gourd comes to mind, but there are other bitter herbs and bitter foods which can really contribute to management of blood sugar regulation. But yeah, largely starchy and simple carbohydrates, refined carbohydrates are really bad for same reason. Yeah.
And so ragi, I heard, is a hyper. It has high glycemic index. So do diabetic patients consume it, or how do they consume it? Because it's in South India, it's very common to eat ragi. So what would you advise?
I find ragi as whole grain consumed like almost cooked as rice or quinoa can be very safe versus when you turn it into flour and then make rotis and chapatis out of it. So understanding what is more processed is one of the things that clients have to spend time with. But whole grain and consumed as wholly as possible is a better idea without processing it further to turn it into a flour or consistency of a batter or dough for rotis and chapatis. So I think ragi in some quantity, and specifically if you're cooking it with other vegetables and other grains such as maybe some brown whole shelled rice or some sort of millets or some beans and legumes, combine them all together is still definitely a better approach than eating just ragi as like one portion of big portion of ragi. That's definitely not a good idea for anybody. I won't advise that for even a non-diabetic. But ragi flour is definitely going to be a big no-no. Whole grain ragi is probably still safer. Yeah.
And so one last question: what there are which type of rice is good for diabetic? The white rice, brown rice, or which will be advisable?
For the GI perspective, brown rice is or wild rice, unpolished rice is definitely much better. The conventional understanding of GI is based on old researches. I think it's changing very rapidly, but so far, healthy guidelines for diabetes is definitely brown rice or rice with bran on it. The shell, the fiber on it. The white refined rice is probably okay in very small amount once in a while. It's not like you can't ever eat it, but maybe try to eat it with other vegetables combined with it. When you're cooking rice with other vegetables, it also has an effect on added fiber to it. But generally, for the GI perspective, I would say brown rice is better, definitely.
Thank you, sir.
Thank you, sir. That was really a very informative session. So, from diabetes mellitus, a disorder that is characterized by reduced effects of insulin, we come to another disorder, which is often associated with insulin resistance, a major risk factor to many disorders such as endometrial carcinoma, dyslipidemia, type 2 diabetes mellitus, and cardiovascular problems. Yes, I'm talking about PCOD, polycystic ovarian disease, or polycystic ovarian syndrome, a very common condition affecting 5% to 10% of women in the age group 12 to 45 years. It mainly affects the female hormone levels, an endocrine abnormality characterized by high levels of LH and GnRH hormones and elevated levels of androgen. The most common and recent definition for PCOS is the Rotterdam criteria, which states that a woman must have two of the following conditions to be diagnosed with PCOS: irregular menstrual periods, multiple cysts in the ovaries, and high androgen concentrations. The cysts that are found in the ovaries are actually immature follicles with eggs that could not be released because of the hormonal imbalance. Now let's look at some statistics. Globally, about 26.7% of women in the age group 12 to 45 years, the reproductive age group, have PCOS. And the sad fact is that most of them go undiagnosed. PCOS affects the ovaries, the female reproductive organs that secrete estrogen and progesterone, the hormones that regulate the normal menstrual cycle in females, and also small amounts of androgen. But in PCOS, the amount of FSH is about normal, but the amount of LH that is secreted and GnRH are elevated. An increased concentration of androgen is also secreted from the female ovaries, leading to follicular maturation arrest, the major hallmark of this disease. Now, PCOS is a constellation of symptoms rather than a specific disease with a complex clinical presentation. So we have menstrual symptoms like abnormal menstruation and absence of menstruation, also obesity. PCOS is often associated with obesity and insulin intolerance because once the ovaries' high insulin levels are found in the body, the ovaries respond to it by increasing the concentration of androgen secretion, leading to other symptoms such as acne, inappropriate male features, loss of scalp hair, unwanted hair, sleep apnea, etc. So the patients often coming to the OPD for medical care for acne, hirsutism, infertility, amenorrhea, etc., they often get diagnosed with PCOD. The exact causes of PCOS is still under research, but it has been established that the pathogenesis has the influence of genetics and other factors such as diet and lifestyle. And as mentioned before, up to 80% of women with PCOD are overweight. But according to research, it has been proved that once the patients start focusing on weight loss by making changes in their lifestyle and their diet, they gain regularity of their menstrual cycle, improvement of hirsutism, and their androgen concentrations get decreased to the normal levels. So girls, that's another reason you should never give up on your workout and diet plans. And inflammation. Chronic low-grade inflammation is a key contributor to the pathogenesis of PCOS. A small trigger of glucose can lead to a rapid inflammatory response in patients with PCOS, and this is often linked to increased androgen levels. Since PCOS has a very dangerous potential to develop into other serious health problems, it is necessary that it gets diagnosed and brought under control really early. So be sure to visit your doctor if you have symptoms such as if you have missed your periods and you're not pregnant, you have symptoms of PCOS that we have discussed, such as hair growth on your face, body and weight gain, or if you're trying to get pregnant for the past 12 months and haven't been successful, or you have symptoms of diabetes, such as thirst or hunger, blurred vision, or unexplained weight loss. So that is the end of the overview on PCOS. And now I would like to hand over to our guest of the day to tell us more about how nutrition plays an important role in keeping this common disorder at bay and preventing its occurrence in the females, especially of the reproductive age group?
Thank you, Leah. Thank you. So I think the biggest issue when I'm working with a client who's struggling with PCOD, PCOS, I saw somebody was commenting if they are similar things. They are similar things. They're just named differently in different countries. So somebody who's struggling with PCOD, the biggest underlying issue I've found or common thread amongst different types of patients or clients that I've worked with, different genetical backgrounds, they still have one thing in common, which is insulin resistance or a similar condition which is related to eating a lot of simple carbohydrates, starchy processed carbohydrates. And how much is right for each individual is something that we take a little longer duration to really figure out. It can depend on genetical predispositions, other lifestyle factors such as activity levels, or even rest and sleep levels, or mental stress management is one of the big components of irregularities in blood sugar. Like stress can really have an impact on your blood sugar regulation, is one of the components that is very, very less spoken about or worked upon, because there is no instant fix for that. People usually take long time to really understand how to manage their own mental capacity of managing stress. It's difficult. It's a skill that people have to spend time in learning. But that's one of the components that I have to touch upon sometimes with clients. Largely, the major result still lies in the category of overall nutrition and lifestyle redesigning or tweaking in some cases. So really staying away from high amounts of carbohydrates, processed, refined carbohydrates mainly, and then figuring out how much of carbohydrates is right for you according to your genetical predispositions and the amount of activity that you are engaged in. Definitely checking the sleep quantity and quality is one of the big components which will have to be considered to tweak your nutrition and activity levels. So sleep, activity, and figuring out diet solutions is what I have really found to be the most useful for clients. There is no specific supplementation that I've found to work very, very accurately with everybody similarly. So some clients are deficient in micronutrition, so supplementation there can help. Some clients who are vegetarian, some supplementation of protein foods can help. One thing about protein I know for sure, and science supports this today, whey protein is definitely not one of the safe supplements for women who are struggling with PCOD, because whey protein is specifically really very insulinogenic. It produces more insulin than plant-based protein supplements. So if I am working with a vegetarian client, they are largely going to use plant-based protein supplements if they require protein as supplementing. And more sleep and rest or mindfulness or meditation habits are critical. They are one of the large reasons why hormones break down, why stress becomes one of the problem in people generally. So yeah, that's my general guidelines for somebody who's struggling with PCOD.
So, since the number of patients affected with PCOD is increasing at an alarming rate, do you think that the growing influence of fast food and hormone-injected poultry meat, is that playing a major role in the number of patients affected with PCOD?
Fast foods or processed foods are probably one of the big components of every lifestyle related or long-term chronic health issues. PCOD, for sure, I would definitely say that's one of the biggest components. Processed, packaged, like these supermarkets are full of these foods today. The stores you walk into, these foods are placed most attractively in right in your face as soon as you enter these stores. So these foods, these aisles where you find processed foods should be really criminalized and thrown out completely. If governments were really trying to fix problems. So I would suggest just definitely fast foods or processed foods are one of the big culprits. But I think personally, meat is a very subjective topic. The lowest quality of meat that I consider, or my clients would, if they ask me, I would recommend them to stay away from, is the poultry industry, because of the same reason as you mentioned here. Injected hormones or antibiotics to make the industry thrive is one of the big components of a lot of conditions, lifestyle related conditions, which fall into the category of hormonal imbalances. So the hormones that are injected in the poultry industry or other commercial farming of animals, these hormones are very similar to human body's hormones. So they are not exactly human hormones, but they will definitely create some confusion and interaction in your own hormonal system of the body. So hormone injected poultry is definitely one of the big dangers for everybody who even doesn't have PCOD will also suffer at some level if they are consuming that food. I never recommend eating poultry. Like commercial grade of eggs or chicken is one of the most toxic foods that human beings can ever consume. That's something that's based on science, but I find this to be one of the big problems in work. As soon as my clients stop eating these foods, there are a lot of symptoms that disappear instantly. But yeah, you're right. Absolutely, these two categories of foods are big problems.
So, what are some physical exercise workout plans that you would suggest for PCOD patients?
Something which is exercise can be very easily understood as something that you want to do to get stronger. But a lot of people think this is something that they have to completely drain themselves every day in. I think very long sessions have a very different hormonal impact versus short duration, decent amount of intensity, like not extremely high, but intensity which is going to tire you up quickly. And duration of a workout session for especially somebody who's struggling with hormonal issues, PCOD falls into that category for me. I would recommend short duration but high intensity. So intensity interval workouts are usually a good idea. I don't recommend long durations of running, especially not indoor runnings at all. That's definitely not great way of stimulating activity in the body. But some sort of functional body weight workouts, it could be added weight workouts also, but functionality is one of the big components when I'm trying to work with clients on this plane of figuring out exercise programs for them. So functional workouts, very short duration, like could be really 15 or 20 minutes of very short rest periods during sets, but in 20 minutes you should be completely drained and tired. That's actually a very hormonally beneficial format of working out for anybody. But yeah, high intensity, to sum it up, I think is a good way to go, and that will generally keep the duration of the workout very short.
Thank you, sir. One last question. Most patients with PCOD, they present with symptoms of insulin intolerance. So once these patients are diagnosed as pre-diabetics, they're highly susceptible to develop diabetes mellitus. So once they are diagnosed as pre-diabetics, what are some lifestyle changes or food items that they could take, or physical exercises that they can implement so that they don't develop a diabetes mellitus, so that PCOD doesn't progress to diabetes mellitus?
Yeah, brilliant question. I think the general guidelines for a person who's specifically dealing with advanced insulin irregulations or insulin resistance is one of the conditions that comes up in a lot of other chronic inflammation related conditions. But again, I'm going to say very similar stuff as I said in the earlier case about diabetes. The complex carbohydrates, a lot of vegetables is the key. That's where you should be focusing more. And in this regard, potato is also considered a vegetable. Unless you were eating potato 3 times a day and big portions of it, that's definitely a bad idea. But once in a while, potato added to your vegetables is not going to harm you. But refined carbs, refined starchy grains, or a lot of white rice, definitely all of these foods which are bad for diabetics or somebody who's struggling with other chronic inflammation related conditions, very similar diets for even PCOD or insulin resistance related complications. Plenty of vegetables, some amount of very moderate amount at least of fats, and this could be saturated and unsaturated both. Unsaturated more, but saturated some bit is definitely fine to eat today, according to new guidelines that have been changed around fat. Some amount of protein coming from clean and reliable sources, not very commercial, hormone loaded poultry industry, but other forms of non-vegetarian food and plant-based protein supplements. This is the basic uh, consist. The combination of these 3-4 foods is where I think most people should look for solutions.
Thank you, sir.
Thank you, sir. It was a one. Thank you, sir. It was a wonderful talk about the importance of nutrition in PCOD. Now, I would like to talk about fatty liver. Fatty liver disease, also known as hepatic steatosis. It is a condition where excess of fat builds up in liver. Often, there are no or few symptoms. Occasionally, there might be tiredness or pain in the upper right side of abdomen. Complications may include cirrhosis, liver cancer, or esophageal varices. Causes: metabolic causes, which is also known as non-alcoholic fatty liver disease, alcoholism, which is also known as alcoholic fatty liver diseases, and other causes can be hereditary, which can have congenital abnormalities, or can be due to high dose medications like anti-cancer drugs, etc. Why? What exactly happens in fatty liver? We all know that liver is a main organ for metabolism. Most of the fat metabolism takes place in liver. Due to the high intake of alcohol and also high fat rich and cholesterol rich food, it leads to the improper metabolism in the liver, which causes high accumulation of fats within our blood, within our body, which can lead to cardiovascular diseases and much more. It can also causes damage to the other organs, and it can also lead to the complication of liver where it can be a complete organ failure. So it can causes other symptoms like weakness, loss of appetite, nausea, jaundice, and much more. Now, I would like to play a video about the overview of non-alcoholic fatty liver disease.
Contain large fat droplets, that person is said to have a The liver is the body's metabolic HQ, detoxifying the blood, making proteins and hormones, aiding digestion and processing nutrients. Most people know it best as the organ that clears up after a night in the pub, and that heavy drinking can cause severe damage. But it's actually non-alcoholic fatty liver disease, or NAFLD, that now has doctors and scientists worried. Linked to the global increase in obesity, 1 in 4 people has a fatty liver. When calories are well matched to the body's energy consumption, the liver orchestrates energy storage and distribution. But when fat and carbohydrate flood the liver, the system becomes overwhelmed and stops working properly. If more than 5% of cells in a person's liver contain large fat droplets, that person is said to have a non-alcoholic fatty liver. At this stage, a fatty liver is still reversible with changes to diet and exercise. But without intervention, things can get much worse, leading to cell death and chronic inflammation. If this happens, NAFLD becomes a condition called NASH. Unchecked, it increases the risk of cardiovascular disease and serious liver problems, including cancer and cirrhosis, which is when scar tissue forms in the liver. Treating NASH is crucial, but even at advanced stages, its symptoms can be vague, and doctors struggle to diagnose it. Currently, we need a slice of your liver, hold the fava beans and Chianti, to spot fat depositions, inflammation, and scar tissue, but there has to be an easier way. Scientists are developing an accurate blood test. Or we can look to the coolest guy in the hospital. New, more sensitive ways of detecting how ultrasound waves change provides a picture of how much fat and scar tissue is in a liver. Numerous studies have shown that diet and exercise can reverse fatty liver and even NASH, but lifestyle change can be the trickiest prescription of all. And if NASH continues to worsen, doctors will want to intervene. Currently, there are no drugs specifically approved for treating NASH. However, hundreds of drug trials are underway. Some drugs act in the gut, halting fat absorption and stopping the release of pro-inflammatory signals. Most target the liver directly, aiming to stop the metabolic stress that triggers NAFLD. Others try to prevent NASH by blocking the effects of metabolic stress, by stopping inflammation and cell death. And some drugs are making progress on that difficult scar tissue. Livers work relentlessly to keep us going, and researchers are working ceaselessly too to better understand, diagnose, and treat this increasingly common condition, helping us all live a healthier life.
Now, I would like to hand it over to our speaker, Mr. Roman sir, to tell us the importance of nutrition in fatty liver.
Hi, thank you, Sushit. One of the big components that I find that works wonders for clients who are struggling with fatty liver, specifically non-alcoholic fatty liver, is foods that have this micronutrient called choline available in it, which is one of the big components for liver functionality. But that's usually easy to find in egg or some fruits and vegetables and seeds, sometimes even supplemented form. But that's one of the big thing that really, really helps a lot of fatty liver clients, choline. But very similarly as other disorders that we spoke earlier or discussed earlier, a lot of vegetables is one of the big components for even these clients. These clients can't process saturated fat very, very effectively. So that's one of the big things that they have to definitely stay away from a decent amount of time unless the doctor's given them a green signal on enjoying the saturated fats again. But saturated fat becomes one of the big complex issues for them. A lot of fruit I find doesn't help them, but some fresh seasonal fruits, some amount is probably safe. But my general recommendation for fruit is really, really small portions, seasonal if they are any. Eating non-seasonal fruits definitely never helps for any healthy body also. But some amount of seasonal fruit and a lot of vegetables is the general guidelines. Complex carbohydrates coming from grains, whole grain carbohydrates are still considered safer for most of these clients unless they have some allergies which are specifically creating stress on the system. So the allergy causing grains are definitely not the safe idea, but whole grain beans, legumes, lentils, a lot of vegetables, that's one of the big components of diet for them. Unsaturated fats, again, are very safe for them, but not in huge amounts because that can also interfere with digestion for people who, because liver has a role in digestion also because it produces bile and cleans bile and recirculates bile. So a lot of times even unsaturated fat can, depending on the extent of the condition, I think unsaturated fat can be slightly technical sometimes, but it's safer than saturated fat. Generally, when I'm working with a non-alcoholic fatty liver client, fats are something that we watch carefully. Activity doesn't harm the liver directly, but there is definitely components of activity which can create excess load on the system. Like a lot of activity sometimes will create toxicity in terms of breaking down muscle tissue, not repairing enough, or the urea load can be one of the big components of creating toxicity in the system, which will have a load bearing capacity related issues with liver and kidney sometimes. Dehydration is one of the big things that I find is definitely connected to a lot of other things, but a lot of times blood pressure fluctuations because of dehydrated bodies. Chronic dehydration is one of the big components that can affect that. So really focusing on remineralizing their water and improving their body's ability to consume more water, hold on to more water, absorb more water is one of the components of improving generally all the conditions. But fatty liver is definitely one of the big things that plays a role here. Yeah. So nothing specifically bad, unless saturated fat was a big component of their diet. So that is something that I would definitely take out for the time being and wait for their doctors to give us green signal for us to start introducing saturated fats again.
Thank you, sir. Sir, now I have a question for you. Now, if a person is diagnosed, if a patient is diagnosed with a liver disease, now he wants to gain a weight. So he has to take some amount of fat food. What kind of diet do you recommend him to have?
I think it's a matter of really prioritizing what we should do first. I don't consider weight gain a big lifelong challenge, but I will definitely consider losing a liver or having a liver in a challenging state is a definite condition that we should address first. Once your liver is healthy and functional fully again, then we can work on gaining weight and then maybe adding more fats that are generally required for healthy metabolism. But for a person who's struggling to improve the liver functionality, I would not ever recommend them to eat for growing the weight of the body. I don't think that's a safe approach, because that will definitely have an impact on liver, irrespective of what's the underlying reasons. So it's a issue of priority. I think prioritizing what is more important to address as an issue is probably one of the discussions with the client that I will probably want to have before. Yeah.
Sir, one last question. During this COVID pandemic, most of them are getting into like junky food, like they're having, and they're becoming lazy. They're not doing any kind of physical activities. Everyone are becoming like, we are completely lazy and they're not having. So can it, what kind of nutrition or what would you recommend to do, like exercise, or what kind of food would you like to recommend so that everyone be in a proper shape and maintain proper diet?
So this was one of the big issues in my work for many years. I have training in personal training. I'm a certified personal trainer, but I don't personally practice that as the primary area in my occupation, but I'm trained in that. So I understand how bodies work and what is good exercises and whatnot. But I'm a big advisor, a big believer in the functional body weight exercises done at home. That concept just will never leave you, because the pandemic proved that gyms are not the most reliable system of maintaining your strength or functionality or health. If you're a person who regularly goes to the gym, then for these past months there were no gyms operational. At least the majority of social gyms, society based gyms, were all shut down. So really developing this mindset of doing the workout in your room, in your kitchen, in your bathroom, in your balcony is one of the big components that will always remain with you as a skill, as a tool, as a very, very powerful way to challenge yourself physically, develop your strength, grow muscle mass. These are really basics of why people work out. But some people believe body weight workouts are not enough for growing muscle mass or growing enough strength for sports or some sort of performance. That's an absolute myth that I don't believe in that. I think body weight workouts can give you a lot of muscle mass, a lot of strength, not at a pro bodybuilder level. That's not what I'm trying to say. Body weight workouts can do very easily, but for general population, to maintain the strength, to maintain the muscle mass that everybody requires for health purposes, body weight workout done in your bedroom, in the bathroom, while you're making coffee in your kitchen, basics, squats, lunges, pull-ups, push-ups, basics. You don't have to get it into a very, very complex system of, oh, this many of this and that. Just do 4 or 5 different exercises every day, as much as you can, reach the state of failure in each and every exercise, and repeat the set till you reach the failure. That's basically the most functional stuff that you can ever do. Even in a gym, it's possible to do, but when you don't have access to the gym, easily done in your living room, bedroom.
Thank you, sir. Thank you, sir. It was a wonderful talk about the importance of nutrition in fatty liver. Now, I would like to talk about food allergy. Food allergy is an abnormal immune response to food. Symptoms of allergic reaction may range from mild to severe. This may include itchiness, swelling of tongue, vomiting, diarrhea, eyes, low breathing, or low blood pressure. When symptoms are severe, it is also known as anaphylaxis. What causes food allergy? We all know that when we take a food itself becomes like a foreign body and triggers our immune response, which it is Ig mediated, which can causes release of histamines. Due to the release of histamines, it causes symptoms and signs like itchiness, swelling of tongue, vomiting, and other complications. It can be fatal and life-threatening. So immediate medication or doctor relieving factors is required. These are 8 common allergens: milk, peanut, egg, nuts, soya, fish, much more. Different people are sensitive to different allergen. So it depends on person to person. So it is very fatal, it involves in your immune system, and it can causes complications, anaphylaxis, which can be. Now I would like to play a video about the overview of food allergy.
During an allergic reaction, the immune system responds to a normally harmless substance as if it were a threat. In some people, common foods such as milk, eggs, and peanuts can trigger such a reaction. So how does this work? If you have a food allergy, your immune system makes a type of antibody called immunoglobulin E, or IgE. This class of antibody binds to immune cells called mast cells and basophils that circulate throughout your body. When you are exposed to the food allergen, it attaches to the IgE antibodies. This binding signals the immune cells to release histamine and other chemicals that symptoms, such as swelling of the lips, hives, and shortness of breath. Because mast cells and basophils rapidly release these chemicals, an allergic reaction typically occurs within 30 minutes after exposure. The most severe kind of reaction is called anaphylaxis, which can cause a sudden drop in blood pressure, trouble breathing, dizziness, and possibly death. People with food allergy and poorly controlled asthma are more susceptible to severe reactions. An anaphylactic episode must be treated with a hormone called epinephrine, which maintains blood pressure and opens up the airways. To deal with accidental exposure, people diagnosed with food allergy are prescribed a medical device called an autoinjector that delivers a single dose of epinephrine into the thigh muscle. Antihistamines alone are not an effective treatment for anaphylaxis. There is no cure for food allergy. The best way to manage the condition is to avoid the allergenic food, read food labels carefully, wash hands and household surfaces, and always carry an epinephrine autoinjector. If you are accidentally exposed to a food allergen, seek medical help immediately. The National Institute of Allergy and Infectious Diseases, or NIAID, conducts and supports research to better understand, prevent, and treat food allergy. In 2010, an expert panel sponsored by NIAID issued guidelines to assist healthcare professionals in diagnosing and managing the disease. And a summary for patients, families, and caregivers can be found on the NIAID website.
These are the few basic signs and symptoms like cough, wheezing, eyes, abdominal cramps, skin rashes, loss of consciousness, difficulty in breathing, and much more. We all know that this all causes due to the release of histamines which are produced by our immune system due to the food acting as a foreign substance. It is basically IgE mediated. It can lead to a complication. We all know that anaphylaxis, so which can be fatal and it can causes death. So immediate medication like epinephrine is required, and immediate doctor consultation is required. Now, now I would like to differentiate between food intolerance and oral allergic syndrome. Everyone might think the food intolerance and oral allergic syndrome might be same, but it is not. Food intolerance, we all know that it is nothing but means that the body either cannot properly digest the food that is eaten, or the particular food might irritate the digestive system, which means that it mainly affects the digestive system. And food intolerance is completely involved with the digestive system, and it can be treatable. It is not much of fatal. Whereas oral allergic syndrome, it is nothing but an allergic reaction where the food itself or the pollen grains becomes a foreign body, triggers an immune response which is IgE mediated and causes anaphylaxis, and which can be fatal. So there is a complete involvement of immune system. So immediate what is that relieving factors like medication is required for oral allergic syndrome, whereas food intolerance we does not need any much of importance, but it is not much of fatal. So basically, food intolerance and oral allergic syndrome is might have same signs and symptom, but it's completely different because there is involvement of different system and different. It defines completely different, and it is different. So now I would like to hand it over to our speaker, Mr. Roman, to tell us importance of nutrition in food allergy.
Thank you, Shashi. Yeah, this is one of the big, rapidly growing concerns for society, and very complex to understand for medical sciences today. I think we don't understand very well as professionals in nutrition or dietitian industry, or a lot of doctors don't have very clear understanding of what causes it. But there are some very definite concerns when it comes to struggling with, like when I'm working with clients who are struggling with food allergies, they are definitely concerned about specific allergies that are related to nuts and seeds, or sometimes just inhaled particles from the atmosphere, which could be just pollen in some seasons specifically, or dust mites and particles which are available in the pollution in like some cities more than others. But I think the general understanding is very confusing when I'm working with a client around this issue. When I work with somebody who's got severe allergies, they also have a lot of intolerances in foods, and it's probably related to the molecule mimicry, or some sort of cross reactivity that just happens in immunity system. I don't fully understand this as of why this happens, but a lot of times when clients are struggling with allergies, if we take out a lot of foods which are on the list of susceptible, just like we have doubts about these foods, and then introduce one by one all of these foods, then we can sometimes figure out with pinpoint accuracy, this is the food which was probably creating some sort of cross reactivity. It's not related to allergies probably, but it will probably have an impact on some sort of immune system. So it could be histamine overactivation. It could be production of excess antibodies for some foods, which may have some cross reactivity. Good examples are foods that fall into intolerances list, which are really popular today, but they are definitely one of the foods that I will try to take out first, and then reintroduce in the right format, right processing, right fermenting, sprouting, pressure cooking. because there are a lot of plant defense compounds which come at like playing this whole intolerances issue, which can have a cross reactivity sometimes with clients who are struggling with allergies. So nuts definitely fall into the category that I will take out. Seeds, sometimes when we reintroduce some nuts and seeds, we will try to introduce them as really nicely soaked, maybe 24 hours, maybe even 48 hours soaked nuts can probably be easier to consume and digest than just raw roasted or the available in the market ready to eat nuts. Nuts are a big concern for food allergies when I'm working with clients. But yeah, this has been one of the big struggles for me. I still can't very accurately understand, because there are a lot of food allergy tests which are not very, very accurate. It's so frustrating for clients sometimes that they spend money on these tests. These are expensive tests, but you still cannot be very sure about which foods are accurately going to be allergens for you specifically for the rest of your life. Like if you repeat these tests, sometimes the false negative is one of the big components of these results. But yeah, I think the cutting edge latest science on this is still not accessible. There are genetic tests, there are very complex tests which are not available in our country. Because I work with patients or clients who are in different countries, they have access to such very high tech testing. So sometimes I have figured out very accurately with testing, these foods are really definitely going to cause allergies for my clients. But they're not very simple tests, so irrelevant right now to really talk about it. But yeah, it's a very, very careful approach when I'm working with a client who's got a lot of allergies. So cross reactivity with foods which are high on intolerance list is one of the big components that I find works well.
Sir, I would like to ask one question. Sir, most of them to maintain their diet, they take protein bars or peanut butter. So, is it good to take those, or would you like to recommend something else?
I'll talk about peanut first. A lot of my clients who work with me probably know my love for peanuts, so I'm just finding it a little hilarious. Sorry. Peanuts are on a list of the most toxic foods for me personally. I tell my clients to stay away from peanuts as far as you can, even if you know you don't have detected allergies. Peanuts are not nuts, first of all, they are legumes. And if most of people know how peanuts are grown and how they are stored and how they are going to be available for you to eat from the market, they will probably understand this is not the safest food available in the market. Peanuts are one of the most mycotoxin loaded foods that you can ever find. Mycotoxins are toxins that are produced by mold. Mold is one of the most toxic type of fungus found on the planet. It's really toxic. And peanuts, when they come out of the ground, they are already loaded with mold. So there are some ways of like sprouting, fermenting, pressure cooking these peanuts, which can probably be slightly safe, but nobody will do this work. Nobody will make peanut butter out of this processing. It's completely rendered useless if you do all this processing for peanut butter market. But peanut butter definitely specifically is not a safe food. Peanuts are no food object for my clients. If they're eating peanut, they are usually not going to tell me. If they tell me, they know it's a bad idea for them. So that's peanut for me. I'm sorry, I know I've probably destroyed peanut butter love for a lot of clients, but this is something that I've struggled with myself a lot. People don't understand peanuts create a lot of allergic reactions, cross reactivity reactions, because mycotoxins are a big component of inflammation in the body. They destroy your immunity system and create serious amount of inflammation, which lasts in the system for decades sometimes. Difficult to take this out from your body. The other food that you mentioned was protein bars. I don't recommend that unless you know how it was processed, how it was made, and you're sure about each and every ingredient in it. That's the philosophy that I use for every packaged food. If you don't understand the ingredients on the list, printed package, then you're safer avoiding it. If you're starving, if you don't have any food to eat, then probably eat one of these foods. That's probably okay. But you repeat that every day or a few times a day for weeks and months, then that is definitely not a good idea. Depending on what type of protein was used in these bars, how much protein, what type of fats were used, what type of preservatives were used, what type of flavors or added agents were used. Some safe protein bars may be available in the market, or just energy bars. Let's not just be restricted to protein bars, because protein bars are generally not really safe in the market. It's going to defeat the economical beneficial purpose for the manufacturer if they create really high quality protein bars. It's just not possible. uh, but yeah, generally energy bars or protein bars are not the safest food. Only in the case of starvation, maybe, yeah. That's
So,
what my approach is. Yeah.
so one last question. What kind of diet would you recommend to the allergic patients? Like exact, like what amount or what kind of food?
Uh, there's a lot of patience required at the end of the client, the patient. Patience in terms of really giving your body time to recover from full-blown serious allergy reactions, because it can be life-threatening if you don't have urgent medical attention required and you don't have access to it. Then it can be serious for a lot of people. So people understanding this approach will probably in long term understand what is the right way of eating for them. So when I work with such clients, I haven't really worked with, this is not the majority of kind of clients that I've worked with, but I've definitely worked with clients who've got serious allergies, and combined with intolerances in food. So for these clients, generally, elimination diet is a point of view towards progress. When we take out mostly everything, keep them on very simple foods, like 1 or 2 ingredient foods. Boiled rice may be one of the foods that we start with, and just keep them on boiled rice for a few days. That's actually difficult to even imagine for most of us, but people who are suffering with these conditions, they probably have given up on a lot of stuff anyways in terms of eating. So they are willing to try this. If they're not, then they require a lot of counseling and understanding of this mindset. If they don't align with the practitioner's mindset, then it's really difficult. It's a struggle for both of them. But elimination diet is one of the approaches. You take out mostly all the foods that may be bringing in hidden cross reactivity possibility, and then start with very simple ingredients, very safe vegetables, some fibers, some grains. Slowly move on to fruits which are not very fermentable in the gut. So FODMAPs is an approach which a lot of people don't fully agree with, but fermentable carbohydrates could be one of the big causes of intolerances, which may look like or feel like allergies. Like they will not have the allergy reactions, but immunity system will be overdriven to protect you, and a lot of environmental components can create allergic reactions. So cross reactivity is always one of the big components. So taking out mostly everything, then reintroduce one by one slowly, and eventually we come to a point where they can eat decent amount of foods again. Yeah, it's a very complex topic. It's not very easy to decipher for generally everybody. A type of diet is not the safe advice that I can feel confident giving out here. It's a very complex topic. Yeah.
Thank you, sir.
So, hi again, sir. So the viewers are requested to comment their queries, if any, as we will shortly be taking them up. Moving on to today's concluding topic, postoperative care and nutrition. Postoperative care is the care you receive after a surgical procedure. The type of postoperative care you need depends on the type of surgery you have, as well as your health history. Depending on the type of surgery, there are many potential complications that can arise. For example, many surgeries carry a risk of infections, bleeding at surgical site, and blood clots caused by inactivity. Prolonged inactivity can also cause you to lose some of your muscle strength and develop respiratory complications. Postoperative care in the hospital. They include two phases: phase 1 or immediate phase, which starts post anesthesia, and phase 2 or intermediate phase, that starts with complete recovery from anesthesia and lasts up to the hospital stay. The aims of phases 1 and 2 include homeostasis, treatment of pain, prevention, and early detection of complications. Next slide, please. Postoperative recovery order. They include monitoring, that is checking for the vital signs, the ECG, the fluid balance, the the other and the other types of monitoring. Respiratory care, that is oxygen mask, ECG, fluid balance. Position and mobilization, that is turning in bed usually after 30 minutes, and special position required for some people. Diet, they include liquid, soft diet, normal diet. Administration of IV fluids, that is the daily requirement in sensible loss and care of renal patient, and medications that depend on their respective surgery. The general postoperative problems. They include pain, IV nutrition, nausea, vomiting, bleeding, deep vein thrombosis, hypothermia, fever, infection, drains, and root dehiscence. I now invite our guest speaker to guide us on the nutrition of post-operative patients. Over to you, sir.
Thank you. I think depending on the nature of surgery, this is easier to create as a dietitian or a nutrition expert who's working with the team of surgeons at the hospital when the patient is discharged. It could be very specific to the case, but general guidelines, I have worked with some clients in this regard where they've been discharged from hospitals after serious injuries or serious surgeries after maybe a few weeks being admitted in the hospital sometimes. But general guidelines are around foods which don't create a lot of digestive distress or requirement to visit the bathroom all the time. Some of these patients can't even walk to the bathroom for a few days. So general hydration levels have to be kept in observation in terms of how much water is required for them just for necessary functions to be perfectly fine. And I think a lot of times doctors who have operated or who have worked with the patient before give these guidelines in advance, and the case has been more closely studied by the dietitian. So I personally won't say anything which is specifically for everybody has to be taken care of. When you're working with such patients, I think you will require more information to confidently say this is what is required. But generally, hydration levels, electrolyte balance a little bit, added electrolytes, maybe if they don't have complications around blood pressure fluctuation. I would definitely put some sort of easy to digest protein supplement in diet. If they can digest solid foods, then maybe some non-vegetarian food if the patient is a non-vegetarian. But supplemented protein usually works very, very easily for a lot of people who are bedridden for a while after the operation or after being in the hospital for a few weeks. So supplemented protein works well. Liquefied vegetables, so soups, or just broth made out of vegetables, or sometimes even broth made out of non-vegetarian foods like chicken soups, mutton. If a patient is into eating non-vegetarian, mutton is one of the meats, goat meat is one of the meats that can be probably substituted for that. But liquid diets should have some protein, should have some micronutrition, vitamins, minerals, should have some water addressed for the body. Fats are usually okay unless they have a complication in specifically liver. So saturated fat, some amount is probably safe, but unsaturated fat is slightly safer than saturated fat if there is a underlying liver complication. But solid foods, absolutely normal chewable solid food is generally never recommended for the first few days, at least for a person who's been discharged after an operation or after a decent few days spent in the hospital. That's basically just mainly for the concerns of giving the body more rest and not creating excess burden in the digestive system. A lot of times patients lying down on bed don't have enough mobility, so digestive system can create a lot of stuck up fecal matter, which leads to constipation, which is a big concern for these patients because it's uncomfortable as it is for them. So creating more discomfort in this system is never the approach that I would probably want to take. But it's a very case specific question that I would like to be more confident to talk about it if I have details specific to cases. I think that's my general guidelines for this.
Yes, sir. So which foods would you recommend that will promote wound healing?
So protein is generally a good idea. Easy to digest protein mainly. So liquid forms of protein supplement or safe protein supplement, specifically if it's a client or a patient who's struggling with healing, then they're definitely not getting enough protein. That's one of the big areas, but you can't give them a lot of solid protein, which may be difficult to digest as it is. But soups or supplemented protein is one of the big components of healing for the body, physiology wise generally. Yeah.
Yes, sir. And are there any foods that they should avoid?
I personally think in a condition like that, a patient bedridden can't eat a lot of food. So main focus should still remain on giving them the minimum quantity of calories that their body requires for functionality, for maintaining the cognition, maintaining vital function of the body. So it could be fruits, it could be vegetables, it could be anything in easy to digest format, but definitely avoiding very, very simple, refined, processed foods, carbohydrates and sugars which are in packaged foods is not a good recommendation. I would definitely not feel comfortable unless there was no other choice. Like if we don't have any other choice at all, then possibly to just compensate for the calories lost, we can probably approach that. But uh, trying our best to provide the patient with the healthy, home cooked, fresh food is one of the big objectives that I would like to emphasize on when I'm working with families who have a patient like that.
Yes, sir. And if a patient is on bed rest for a long time, do you recommend they take a low carb diet, or is it fine if they take it as it may help in healing? What do you suggest?
So low carb diets are not necessarily good for anybody. I don't think low carb diets are understood very easily. People just say low carb, but low carb really means very, very less amount of carbs and difficult to achieve. I'll give you an example. Eating just vegetables is actually quite a lot of carbs for the body already, for functionality sake. The necessity of carbs is very low for the body. Carbohydrates don't fall into the category of essential nutrition at all. Like there is essential fatty acids, essential amino acids. There is nothing like essential carbohydrates. Our bodies don't require essentially just eat carbohydrates. But low carb is not a recommendation. Low carb will mean you're not eating even vegetables, basically. That's what I would see as low carb. So eating a lot of vegetables in easy to digest format is always a recommendation for everybody. But for a person who can't digest solid food, definitely pureed or souped vegetables is one of the big components, and it will have decent amount of carbs. But low carb sometimes can refer to, in a popular manner, avoiding simple carbohydrates, avoiding sugars, which are like sweet foods, avoiding refined flour based foods like white bread and loaf of bread, which is just refined flour. So sometimes that is not a good recommendation for a person who's recovering. But if they can't eat anything, definitely give them that refined carbohydrate also, because they need some calories to recover, to have the vitals working and to have enough cognition so they are in senses. But low carb is not easily understood by a practitioner like me. I will never recommend low carb for anybody. But that also means there is very less amount of carbs that we require. That's what I'm trying to refer to. Is that clear?
Yes, sir.
Does that answer your question?
Yes, sir, it does. So thank you, sir, for patiently enlightening us. Now we would like to pick out a few questions from our audience. So some of the questions we received are, there are many artificial sweeteners in the market. Are they safe and better for diabetes?
Um, I will recommend that to cases where they really need sweet flavor in the food. So there are some safe ones. There are some really unsafe, toxic ones. And there is a long list of artificial sweeteners available today. Lots of them are sugar alcohols. Lots of them are plant extracts. Lots of them are just uh, serious, like plant extract ones are usually safer. Stevia is a popular one in our country, which is easily accessible. Stevia works well, but there is a component of eating sugar or even just imagining sweet uh, producing a lot of insulin in the system already. There is a component of, this has been available in science today. So I will definitely speak to my clients about that first, have them understand the concept of what sweet can do for the body in long term, and then give them healthy, safer replacements. I don't think it's a good idea for everyone to consume sugar replacement or artificial sweeteners, but less processed and plant-based ones are the safest ones. Some of them are stevia, monk fruit. Monk fruit extract is probably not very popular in our country, but it's one of the safest sugar replacements that I've found, and it tastes decent. Stevia is also pretty okay, yeah. But please look into this aspect of not relying on it. It's not a good idea to rely on sweet flavor for long term, definitely.
Yes, sir. So, are there any foods that will reduce the side effects that result from hormonal treatment for PCOD?
There can be very different hormonal treatments for PCOD. So hormone replacement therapy or figuring out what they are on will probably create some sort of nutrition advice specific to that. But generally, when I'm working with a person who's been struggling and is on medication for PCOD, I would try to figure out what their medication is and what their doctor's guidelines are for nutrition. There can be a component of hypoglycemia. There are a lot of people who are eating a lot of carbohydrates and they are very insulin resistant, and they may have some sort of medication to deal with insulin sensitivity and resistance in the body. So tweaking their carbohydrate intake can be sometimes complex. So you can't instantly take the carbohydrates down. That may have an impact on blood sugar regulations, and that is a dangerous component for anybody. Hypoglycemia is not very safe, especially if you're not in safer surroundings. So that's one thing I'll be careful about when I'm working with a client who's on medication for PCOD. But if there are hormone replacement, then they have to figure out really with their doctor's guidance and the practitioner of diet and nutrition they're working with. But there is no specific side effect that I am aware of in this regard that will be addressed with a specific type of food. Yeah. Is that clear
Yes, sir.
to?
Yes, sir. I got your answer. And so, would you recommend any Ayurvedic supplements, or do you think they should be avoided because it's not, it doesn't have enough evidence? I know this is a controversial topic, but in your experience, what have you seen? Do you recommend it, or it is best avoided?
I think I'll definitely not say yes or no, I recommend or not. I will give you guidelines about this. Ayurvedic herbs or any herbal supplements can be potentially loaded with heavy metals. That's one of the big concerns when I'm dealing with supplementation. Toxicity is one of the big problems with herb based or traditional medicines from different cultures. Ayurveda specifically, because we in India really believe in it, and I believe in some of these herbs tremendously. They work magically, but I will not say specifically which works, which doesn't. And I will only request clients to usually really do research and investigate the source of the supplement and really make sure the companies they're using have tested their herbs for heavy metal toxicity, because heavy metal is a big component of any food that we grow on the planet. It is all just in the soil. So some plants naturally concentrate specific elements from the soil. So please be careful about which companies you buy from, which companies are putting the right practices in place in terms of production and manufacturing, and then make the choice. I personally don't have anything against it. I'm just really careful about toxicity bit of it. Yeah.
Yes, sir. Sir, would you like to give any nutritional advice for the thyroid patients, for hypo and hyperthyroid patients?
They can be similar in some way, but definitely very different components of symptoms and irregulations in the body, but similar in a way that most likely there are micronutrition deficiencies. Most likely hypo and hyper, both thyroid conditions are coming from stressed out bodies. I have definitely worked with cases where the hypo cases turn into hyper cases. It definitely happens. It's rare, but it has happened with me. I've experienced this in work. And maybe there is some science available on this also to support this. But generally, when I'm working with clients who are struggling with hyper or hypothyroidism, there are components of food intolerances. There are components of deficiencies, which is a really big one. People don't pay attention to deficiencies of specifically trace minerals, and minerals are a big component of thyroid functionality. But which ones are safe, which ones are not, are very case sensitive, very case specific. I can't say that out loud for everybody as a guideline, but look into micronutrition deficiencies, look into toxicity. A lot of times detoxification is a big component which can create, and there is a myth in the industry around not eating cabbage, not eating cruciferous vegetables, which has got to do with a gene SNP, which is around detoxification, but it can probably have an impact on your thyroid or other functionality in the system. But it is a very complex topic. It's the whole hypothalamus pituitary adrenal gland pathway interruption, which is not very simple for this webinar to get into right now. But I've definitely dealt with cases who have food intolerances, which can be just easy to take out from your existing system of eating, and your thyroid system really comes back online fully. But micronutrition deficiencies, food allergies, intolerances, detoxification, a lot of stress, mental stress is one of the big components that is common. So mentally really stressed out people definitely have some thyroid irregulation. Thyroid, according to some traditional medicines, is a seat of emotional health. Like it's one of the emotional health aspect of the body. A lot of people who are not vocal enough, a lot of people who don't express their emotionality, their emotional experiences of life, and just pent up anger and frustration can create some imbalances. And it's probably not very scientific, but that's definitely a component that I found in work. So I've recommended some clients to start singing or practice singing or learn singing. Singing is one of the beautiful exercises for this throat area, which can probably increase your blood circulation in the region, but also thyroid gland is associated with expression, vocal expression, literally. So that's one of the unconventional tools that I've used in clients with extensive cases of thyroid.
Yes, sir. That was a really nice advice. One last question, sir. So diet to prevent osteoporosis, and especially in vegetarians, like when they have vitamin D deficiencies, what would you suggest?
I will start with vitamin D first. It's near and dear to my heart. I wanted to speak about this yesterday, but we just couldn't come to that topic. Vitamin D is a big concern today. In my work specifically, I deal with this as deficiency is definitely a bad idea. It's terrible for the body, but toxicity of vitamin D is life-threatening also. Like it's bigger concern today for most, at least in India. We get a lot of sun exposure and we still have decent amount of fat in our diets. So synthesis of vitamin D is not that bad. I know there are a lot of people who stay indoors who are into not having this tan or dark tone of skin in our culture, but some amount of sun exposure, because we are in this part of the planet where there's decent amount of sun exposure. So vitamin D synthesis on our skin is still not that bad as for somebody in the northern hemisphere. So vitamin D supplementation, high doses, 60,000 IUs a week and stuff, which is a very common advice that I see today happening. and it's easy to access on Google. That's one of the big concerns here. A lot of people just see this, oh, vitamin D is helpful for your immunity system, let's get a truck full of it and just consume it. That's a dangerous idea. That the toxicity of vitamin D will create serious imbalances in a lot of other vitamins and minerals which are required for vitamin D to function very well. So, for instance, vitamin D doesn't work without vitamin K2, without vitamin A, without vitamin uh, E in some cases, calcium and magnesium. These are two components of mineral composition which comes into play when you're looking at vitamin D. So bone health is not just vitamin D and calcium. There's a lot of other minerals and vitamins go into play. And there's a lot of research on this available, obviously. So when I'm working with clients, I'm never going to be comfortable of advising just standalone vitamin D supplementation. It's a very, very dangerous idea for a lot of people. But vitamin D is necessary. It's a concern also in the naming of it. Vitamin D is not technically a vitamin. Somebody who named it messed it up completely for us. In generations, we have not understood this. Like for general population to know it's not a vitamin, it's a hormone, then maybe people will start being more careful with it, because people understand hormone replacement is not just such a casually done solution. So it's a steroidal hormone which is synthesized in your cells with a very complex electrobiological system in your cells. It's not very, very simple to just replace it in the body. That's one of the big components of work for me that I struggle with, that clients are dealing with toxicity of vitamin D, which is dangerous. So other point is the diet for bone health is generally rich in all colors and all types of vegetables. Mainly, that's one of the big components of bone health, because vegetables bring in really good amount of vitamins and minerals in the body, which are critical for doing this whole loop of a lot of processes. It's not just you take this and bones are fine. You need activity. You need to take out foods which are destroying your joints and bones. There is a component of allergies or intolerances that can be destroying your bones sometimes. So rheumatism is one of the big components which comes into play when you are looking into bone health. So rheumatoid arthritis is one of the big issues today. It's autoimmunity based, but really understanding the foods which are destroying your bone health is a component. Then taking those out is important. Diet, which is I know works wonders for people who are struggling with bones, is rich in collagen. Collagen is not a vegetarian food. Collagen is specifically a non-vegetarian food. So people who have strict system of eating around non-vegetarian versus vegetarian, they may not be able to access that. Even a supplement of collagen is created from non-vegetarian systems. So collagen is a big component of bone strength because it gives you elasticity. It gives your bone a lot of strength in that way. But then obviously the popular minerals are calcium.
So can milk help?
I don't think so. I'll tell you why. The calcium in milk is a very poor form of bioavailable calcium. It doesn't work very well for absorption. A lot of people have been advised for generations to consume milk for bone health, but I personally don't think it works very well. The calcium that is useful for your bones is good to obtain from other foods, definitely not milk. But like some grains, some seeds, some vegetables is still a good idea. But excess of calcium is not necessarily going to make the bone strong also. So you need other components which make the calcium molecule go inside the bone. Otherwise, calcium molecule circulates everywhere else and destroys a lot of other stuff. So really holistic approach of looking at bone health is a bigger advice that I will be interested in putting out comfortably. Yeah.
So, so the takeaway from today's webinar will be that everything will have a different approach. Vegetables are very, very important. Exercise and letting your emotions out, living stress-free, eating well. I think these are the major components.
Yes, I agree. Yeah, definitely.
So on behalf of SIMSA and the organizing team, Thank you so much, sir, for this extremely informative session, and that too at such a short notice. I'd like our viewers to know that initially this webinar, actually Dr. Gautam was going to take it, but because he had some personal schedule change, he couldn't do it. So sir helped us in the last minute. So thank you, sir. And it was great having you with us, sir. I'd also like to thank the audience for their patience. It was a long session, 2 hours, but I hope this webinar has helped the audience in some way, and that they will take away at least some tips that may help them, their family members, or their friends at some point in time. Thank you, everyone. Is there anything you'd like to conclude with, sir?
Thank you, Lakshita. Thank you, Simsa. Thank you, the audience. Thanks to everybody who's been patiently watching. These sessions are becoming longer than we are originally planning initially, but thank you for the patience. All the audience is making time for this. It's a great opportunity, and it's such a great honor to be here and try to talk about these issues. I'm very, very passionate about this. So thank you. And yeah, that's it.
Thank you, sir. So signing off, this was South Indian Medical Students Association, Karnataka, in collaboration with SIMSA Kerala and SIMSA Andaman and Nicobar for World Food Day. See you tomorrow for the third and final webinar of our 3-day webinar series, Spill the Beans for a Healthier Tomorrow. The topic will be eating disorders. So stay safe, stay healthy, take care, and goodbye.